Hey, good afternoon. My name is Stacy McCrory, and I'm a nurse practitioner student at Auburn University. And today I'm going to be interviewing two non-medical subjects about the role of a primary care nurse practitioner. My first participant is Trey. He is one of my best friends from high school. He actually has a degree he's an educational specialist, and he also does physical education. So we're going to have fun. I hope you learned something from this, and let's get started. So what do you think a family nurse practitioner is?
I believe the primary care of small children. I
Okay.
don't know, that could be wrong.
No, it's okay. What do you think an FNP, like the nurse practitioner does?
Um,
It's okay. The dogs can bark. They probably want to answer too.
I believe it's I don't know, I always get them confused, but would see patients like a doctor would, but doesn't quite have all of the same authority or the same, I guess, the abilities to write prescriptions or stuff like that as some of the same jurisdiction and some of the things that they
Okay.
can do.
Yeah, that was one of my next questions, is if you think that an FNP can prescribe medications or prescribe like narcotics.
No, I don't think so.
Okay.
Maybe.
Do you think that they can diagnose illnesses and like manage acute and chronic illnesses?
Yes. So I
Okay.
guess then yes, and they probably can. If they can do that, then they can do. I would think they'd be able to write prescriptions. So maybe change my answer from before.
Okay. Do you think that the family nurse practitioner has to collaborate with a physician?
Yeah, I would think that they collaborate in a sense. I don't know if like you have to defer to it as much as like they would at least seek an opinion, maybe a second opinion on things if needed.
Mhm.
But
Okay.
I don't know if it's so much that they answer to a doctor, like to a physician.
Okay. Do you think they can order like blood work, x-rays, like diagnostic tests? Like say you broke
Yes.
your arm. Okay. Do you think they can do simple procedures in the office? Like if you came in with a huge abscess on your arm and it needed draining, do you think that the family nurse practitioner could do that?
Yeah, but I would guess that there's some kind of like limit on like even an outpatient, like not so much like a surgical thing, but something that's a little more procedural, I guess. Yes, but I don't. Yeah,
Okay.
something simple like your example. Yes, I do think that they could do that.
All right. And then do you think that the nurse practitioner can bill for their services? You know how like physicians bill for their services.
Yes.
Okay. And then the last question is, do you know the difference between a nurse practitioner and a physician's assistant?
No clue. Couldn't tell you if you at all.
Well, you did pretty good. A family nurse practitioner is basically an advanced practice registered nurse. We work autonomously and in collaboration with healthcare professionals and other individuals. We provide, well, I'll be able to provide a full range of primary, acute, and specialty healthcare services. Like nurse practitioners are found in the primary care setting, in the hospitals, the ERs. They can even specialize in pediatrics, oncology, women's health, all different kinds. They do diagnose and manage acute and chronic illnesses like, hypertension, which is high blood pressure, diabetes, infections, injuries. They can order, perform, and interpret diagnostic testing, so like lab work and x-rays. They are able to prescribe medications. Now you have to have in order to, well, Georgia, you first have to have this agreement, like this nurse protocol agreement by the Georgia Composite Medical Board. And then if the nurse practitioner is wanting to prescribe like controlled substances, you have to get a DEA number. And you actually, they can't prescribe Scheduled II controlled substances like your morphine, your Dilaudid, oxycodone, fentanyl, all the good stuff. Nurse practitioners can't prescribe that. So then they have to use a physician. Now, there's 3 different types of practice for a nurse practitioner in the United States. There's full, reduced, and restricted. And fortunately, Georgia is one of the restricted practice states. So general supervision and delegation is required. So like there's an agreement made between a nurse practitioner and a physician, and it's usually they have to practice in a comparable specialty area. So like you wouldn't find a cardiologist sponsoring some nurse practitioner in oncology. You know, they have to have the same type of specialty. But basically, they have to be there for immediate consultation, whether it's physically or with direct communication. So like by telephone, they just have to be able to be there. We can do simple office procedures like the incision and drainage that I asked you, like ingrown toenail or fingernail removals. We can do laceration repairs, simple and complex, like if you cut your arm and you need it sutured or stapled, we can do that. And then like digital blocks, aspiration, like if you needed something in your knee, like the fluid aspirated, we could do that. But of course, you know, you have to be trained. And then finally, the nurse practitioner versus the PA. So nurse practitioners are registered nurses that go back for postgraduate training. And with your training, you focus on the core is the 3 Ps, your advanced patho, your advanced physical assessment, and your advanced pharmacology. So once you graduate, in order to sit for your boards, you have to have those 3 classes, and you have to have clinical hours. And there's different certification boards you can sit for. Once you sit and you pass that, then you can apply for your licensure. So it can be very confusing. Now the PA, it doesn't necessarily have to be a registered nurse. That program uses the medical model. So they have only one certification the test they can take, and they actually can't practice independently at all. They must have a physician over them. But they do the same things, like they can do the same diagnostic, like ordering things. They just have to order under physician. And a lot of them do like the surgical route. Plus they actually have to have at least 1,000 clinical hours, I believe, 1,000 to 2,000, where for the NP, you only have to have 500. So I hope you learned something. I hope this was fun for you. And thank you so much for letting me interview you.
Yes, ma'am. Thank you for having me.
Okay, my second participant is my cousin Kyle, and he actually has a background in mechanical engineering. So again, this is supposed to be fun. I want you to answer honestly, and hopefully you'll learn something. So what do you think a nurse practitioner is, and what do you think they can do?
I don't know a whole lot about nurse practitioners. I just know that they're a step up, I think, from RNs, but below a doctor. And that's about as much as I know on them.
Okay, that's good. Do you think they can diagnose illnesses and manage chronic and acute illnesses, like if you have high blood pressure or diabetes?
Honestly, I don't know, but if I had to guess, I would say yes.
Okay. Do you think that a nurse practitioner has to collaborate with a physician?
Yes.
Okay. Say you broke your arm and you went into the office. Do you think the nurse practitioner could order an X-ray or other diagnostic tests like lab work?
Yes, I'm gonna say yes.
All right. Do you think family nurse practitioners can do simple office procedures like if you cut your arm and you needed it sutured or stapled? Do you think that a nurse practitioner could do that?
Yeah, I think they could.
I'll say you need like an antibiotic. Do you think the nurse practitioner could write the prescription? Do you think they can prescribe narcotics
I'm gonna say no.
for both? Like any
Yeah,
prescription?
for both. Yeah.
Okay. What about billing? Do you think that nurse practitioners can bill for their services? Like if you saw me in the office and I am not the doctor, do you think that I could bill your insurance or you if you didn't have insurance?
I have no clue, but if I had to guess, yes.
Okay. And the last question is, do you know the difference between a nurse practitioner and a physician's assistant, or what we call PAs? Or have you ever heard of a PA?
I think I've heard of it, but I do not know the difference.
Okay. So good. I'm able to educate you some. Family nurse practitioners are advanced practice registered nurses, and they work autonomously and in collaboration with other healthcare professionals and physicians. They provide a full range of services with primary care, acute care, and specialty areas like cardiology, like psychiatric care, mental health, which is mental health, and women's health, all different kind of specialties. They do diagnose, manage acute and chronic illnesses, so like your diabetes, your high blood pressure, asthma, thyroid. If you have infections, any type of injuries, they can manage that and diagnose it. They can order tests like your x-rays, your blood work, all the diagnostic tests, and they can even do simple office procedures. So like if you have an abscess and you need it drained, if you have an ingrown nail somewhere, they can remove that. Laceration repairs, which is what the cut is, you can suture and staple those, and even digital blocks. But of course, you have to be trained. You can't just go in there blind. And they do have to collaborate with a physician. The United States has 3 different type of practices: full, reduced, and restricted. And unfortunately, Georgia is a restricted state. So that just means that at least one of the NP areas is fully restricted, and that there's basically a protocol agreement with a nurse practitioner and a physician, and they have to be in comparable specialty areas. So if I was in pediatrics, I wouldn't have a sponsoring physician that was in adult gerontologic, which is those older, like 65. And they have to be there for immediate consultation. So whether it be in the office or via direct communication, like a phone call, that is required. Nurse practitioners can prescribe medications. So in the state of Georgia, though, you first have to have this protocol agreement with the Georgia Composite Medical Board. And then if the nurse practitioner is going to prescribe controlled medications, they have to have a DEA. And they actually can't prescribe Schedule 2 controlled medications. So like your morphine, your fentanyl, your Dilaudid, the methadone, oxycodone, all those medications a physician has to order. Nurse practitioners can bill for their services. So whether your patient has government insurance, like Medicare, Medicaid, or commercial insurance, the Center for Medicare and Medicaid Services, which is CMS, they have established specific guidelines, and then also the commercial insurers have varied requirements. So it just depends on what kind of insurance your patient has. And then lastly, the nurse practitioner compared to the PA. So your nurse practitioners are, they are trained registered nurses. They go back to school to get a postgraduate training, which could be a master's or actually a doctoral degree. And we focus on the 3 Ps, which is advanced form, advanced patho, and advanced physical assessment. So basically, once we graduate, we have to take a certification test. And in order to sit for that test, we have to have those 3 core classes and at least 500 clinical hours. And then once we're certified, we can then apply for our license. Now, a PA is kind of different. They don't have to be a registered nurse, and they kind of follow the medical model route. So they go, the first year is all about the classroom courses, learning medical terminology, anatomy. And then that second year is focused in their clinical hours, and they actually have to do at least 1,000. And PAs don't have any independence from a physician. They always have to have a physician when they order stuff. So I hope you learned something from this. Maybe you'll be able to go out and teach somebody something. And I just want to thank you for letting me interview you.
Well, thank you. Learned a lot.